Welcome to Qatar Metabolic Institute.
Do you know what obesity is? How do you know that you are overweight or obese? How to lose weight? How to maintain your weight? What type of medication and surgeries help you to lose weight? All these questions will be known to you after watching this video.
Obesity is. Obesity is a chronic condition produced by an excess amount of body fat. A certain amount of body fat is necessary for storing energy, heat insulation, shock absorption, and other functions. Body mass index is the best guide to obesity. A person's height and weight determine his or her body mass index. The body mass index, BMI, equals a person's weight in kilograms divided by their height in meters squared. More information will be found later in the article. Since BMI describes body weight relative to height, there is a strong correlation with total body fat content in adults. A person with a BMI of 18.5 to 24.9 has a normal body weight. An adult who has a BMI of 25 to 29.9 is overweight, and an adult who has a BMI of over 30 is obese. A person who is morbidly obese, extreme obesity, if his or her BMI is over 40. What are the health risks associated with obesity? Insulin resistance, type 2 adult onset diabetes, high blood pressure, high cholesterol, stroke, heart attack, congestive heart failure, gallstones, gout and gouty arthritis, osteoarthritis of the knees, hips and the lower back, sleep apnea, excessive eating, genetics. A person is more likely to develop obesity if one or both parents are obese. Genetics also affect hormones involved in fat regulation. Frequency of eating. Medications associated with weight gain include certain antidepressants, anticonvulsants, and some diabetic medications. Psychological factors affecting some people and emotions influence eating habits. Many people eat excessively in response to emotions such as boredom, sadness, stress, or anger. While most overweight people have no more psychological disturbances than normal weight people. Diagnosis. To diagnose obesity, your doctor will typically perform a physical exam and recommend some tests. Taking your health history. Your doctor may review your weight history, weight loss efforts, physical activity and exercise habits, eating patterns and appetite control, what other conditions you've had, medications, stress levels, and other issues about your health. A general physical exam. This includes measuring your height, checking your vital signs such as heart rate, blood pressure and temperature, listening to your heart and lungs, and examining your abdomen. Blood tests. Calculating your BMI. How can you lose weight? Dietary changes. Cutting calories. The key to weight loss is reducing how many calories you take in. The first step is to review your typical eating and drinking habits to see how many calories you normally consume and where you can cut back. Feeling full on less. Some foods, such as desserts, candies, fats, and processed foods, contain a large amount of calories for a small portion. In contrast, fruits and vegetables provide a higher portion size with fewer calories. By eating larger portions of foods that have fewer calories, you reduce hunger. Making healthier choices. To make your overall diet healthier, eat more plant-based foods such as fruits, vegetables, and whole grain carbohydrates. Meal replacements. These plans suggest that you replace 1 or 2 meals with their products, such as low-calorie shakes or meal bars, and to eat healthy snacks. Exercise and activity. Increased physical activity or exercise is an essential part of obesity treatment. Most people who are able to maintain their weight loss for more than a year get regular exercise, even simply walking. Keep moving. Regular aerobic exercise is the most efficient way to burn calories and shed excess weight. Prescription weight loss medication. Your doctor may recommend weight loss medication if other diet and exercise programs haven't worked and you meet one of these criteria. Your body mass index, BMI, is 30 or greater. Your BMI is greater than 27 and you also have medical complications of obesity, such as diabetes, high blood pressure, or sleep apnea. Anti-obesity medications approved by the Food and Drug Administration, FDA, include orlistat, phentermine and topiramate, bupropion and naltrexone. Weight loss surgery. Weight loss surgery for obesity may be considered if you have tried other methods to lose weight that haven't worked, and you have extreme obesity, BMI of 40 or higher. Your BMI is 35 to 39.9, and you also have serious weight-related health problems such as diabetes or high blood pressure. You're committed to making the lifestyle changes that are necessary for surgery to work. Gastric bypass surgery. In gastric bypass, the surgeon creates a small pouch at the top of your stomach. The small intestine is then cut a short distance below the main stomach and connected to the new pouch. Food and liquid flow directly from the pouch into this part of the intestine, bypassing most of your stomach. Adjustable gastric banding. In this procedure, your stomach is separated into 2 pouches with an inflatable band. Pulling the band tight, like a belt, the surgeon creates a tiny channel between the 2 pouches. The band keeps the opening from expanding and is generally designed to stay in place permanently. Gastric sleeve. In this procedure, part of the stomach is removed, creating a smaller reservoir for food. It is a less complicated surgery than a gastric bypass or a biliopancreatic diversion with a duodenal switch. Endoscopic sleeve gastroplasty, also known as the accordion procedure. This is a weight loss procedure that uses an endoscopic suturing device to reduce the size of your stomach. The procedure recreates what would occur at a surgical sleeve gastrectomy without the need for surgery. Finally, there are several possible contributors to obesity. The fact that the 2 biggest ones, diet and activity, are ones you can influence is good news. A healthy lifestyle that puts exercise and eating well at its center can also bring other health benefits. And if you already have obesity or are overweight, these strategies can help you lose weight. Although it can be challenging at times, it is a journey worth taking. For any more inquiries, please contact the Qatar Metabolic Institute.